Thank you everyone once again for joining in on the free webinar tonight. Tonight we'll be talking about the kaps pathways of becoming an Australian pharmacist. We're going to be navigating through what it takes from the beginning of the process up until the end of the process. And the end, I would say, is when you've become a general pharmacist. A little bit about myself today. My name is Maureen O'Con. I am an Australian pharmacist. Just give me a sec. I'm just letting someone in. Okay. So like I said, my name is Maureen O'Con. I'm an Australian pharmacist. I'm a mother of a little boy of 6. So I understand what it means to transition into being an Australian pharmacist, as well as coming along with your family. In addition to being a pharmacist, I'm a clinical educator and facilitator. So what that means is I train other pharmacists, interns to be precise. I've done a lot of work with PSA as a coordinator in their intern training workshops. I've done some webinars with Australian Pharmacy Council also. I'm also one of the senior managers in one of the biggest groups here in Canberra. For those of you who are familiar with Chemist Warehouse. So again, I am a community pharmacist, like I always like to introduce myself. But in all of these, I'm an overseas trained pharmacist. So whatever pathways, the kaps pathway is something that I understand very well because I've gone through that pathway. Just a disclaimer, I am a community pharmacist, so most of the things I might say might be skewed to community pharmacy, but feel free to ask questions or clarifications if anything you need to clarify. I know for some people, the reason you've joined this webinar today could be a lot of reasons. For some people, it might be because you're stuck in the pharmacy career, wherever you're living. For some other people, they just want change. For some other people, it's for migration purpose. But whatever it is, I'm just going to go through the whole process. Now, in terms of the kaps pathway for today, at the end of the day, this is what I expect you should go home from today. Understand the kaps process, understand a little bit of the kaps exams, the kaps syllabus, what is expected, and also what is the steps in between the kaps and when you actually become a pharmacist in Australia. And finally, I'll be talking about today's pharmacist. What is the scope of pharmacists in Australia? As of today, 2024, I'm sure in the news, most of you are hearing different things about pharmacy practice in Australia. I'll be going into the fine details so that you really understand what it's really about and how you can stay ahead of the game. So I'll just go straight into it because I want to have time to explain this and give you time to ask questions. Now, if you have any questions as I speak, please pop it into the chat and I'll try as much as possible and answer as much as I can. And if for any reason, for time constraint, I'm not able to answer everything, I'll get back to you if I do have a contact on how to reach you. Now, let's talk about the first process. kaps exam. Now, kaps exam is what most people hear. The first thing, you hear people saying, I want to sit the kaps exam. I want to take the kaps exam. Now, the kaps exam is the knowledge assessment pathway. So usually it is the first step for people who did not study in Australia, or if you did not study in any of the listed countries. I think I'll talk a little bit about that later. So for most of us who have studied in countries like India, any country, that's not the US, now you may be practicing in the UK, but if you did not do your first degree there, you would also need to go through the kaps pathway. So it's very important to understand that the kaps pathway has to do with where you studied, not where you are working at the moment. Now, for you to even take the kaps exam, the first step would be to see, are you eligible to take the kaps exam? So the eligibility check phase, that's where they check where have you studied. Your pharmacy study, is it equivalent to Australian pharmacy study? They would check some key documents. So that's why we talk about gathering of documents. Gathering of documents is very important. Before you start the pathways, make sure that your documents, such as your transcript, you have an international passport, and these things must be in English. So if you have any document that is not in English, you would have to translate those documents in English. So this is just a summary, because I can't go into every detail in this particular webinar. Now, after you've gathered the documents, you get a candidate profile on the Australian Pharmacy Council website, and then they will check if you're eligible to sit the KAP exam. Again, this is just the eligibility check. Usually that would take about 8 weeks, and it costs about $800 or so. Now, when you finish your eligibility check, you can now register for the KAPS exams, you sit for the KAPS exam, and then, you get an assessment later. I'll go more into those in details. So, like I said, the first thing is to pass the eligibility check. And after you pass the eligibility check, this takes about 8 weeks for this to be completed, but you have to make sure that all your documents are correct. Otherwise, if they are not correct, it's going to take a longer time. And then the next thing, you go into the passing of the KAPS exam. After you pass the KAPS exams, then we go to the next step. Now, just know that the KAPS eligibility check is valid forever. So you can do that as your first step while you plan the other step. It wasn't like this before, but they updated it the past few years. So you can now use that eligibility for a long time. So for the initial skill assessment phase, like I was talking before, these are the key documents that you would need, right? You would need a passport that is up to date. I advise, if your passport is about to expire, update it so that it can cover you for the process. You need your birth certificate, you need your qualification, you need academic transcript, and you need evidence of registration if you're already practicing as a pharmacist. Now, if there's any change of name for us women who get married and maybe we have changed our names, you would also need evidence of change of name if your documents do not have the same name across all the documents. Now, after you finished your eligibility check process, like I said, it takes 8 weeks. You submit all the documents into the portal, and then you wait for the response from Australian Pharmacy Council. After 8 weeks, if you get a positive feedback, then you can now go ahead and apply for KAPS. Now, just take note, at this point, you would not be able to register for the exam until you get this eligibility check. So just keep that in mind. So when you're planning when you want to take your KAPS, make sure you accommodate this time. Now, another thing you would need in this process is your English test. Usually you would actually need it after you've passed your KAPS exam, but it's really important to start thinking about it. So for most of us who have studied abroad, overseas, outside Australia, most of us, English is not our first language. So it's important to make plans to study and make sure you get the required scores. So you can write the IELTS, you can write PT. For some people, they do write OET, whatever it is, write the one that suits you best. And like I said, you will have to pass the KAPS exam. Now, let's talk about the KAPS exams, because a lot of people ask questions about the KAPS exams. They do ask, is it difficult? Is it easy? Do I need 1 year to prepare for the KAPS exams? Do I need a lot of time to prepare. And my simple response usually is, it's not difficult. It only the most important thing is you need to be studying the right thing. You need to have good support system, and then you can write it within a short time. You don't need like years to prep for it. During my time, I prepared for it in just a few months. So it's very possible with the right resources and with the right support system. There's a lot to read. It's quite broad. So if you're not careful, you might just be going ahead studying things that are not important. So if you go on the Australian Pharmacy Council website, you find a lot of information. Now, the good thing about Australia is one of the countries that allows you to write these exams outside Australia. So we've got about 33 countries as of this year where you can write your kaps exams. Now, in terms of where, depending on where, so if you live anywhere around this country stated here, Botswana, Canada, Egypt, Fiji, Ghana, Greece, Qatar, Saudi Arabia, Singapore, Spain, South Africa, Taiwan, Thailand, India, Istanbul, of course, UK, Zimbabwe, you can sit this exam. So if you live around these places, you can actually go there to sit for the exams. So which is a big advantage for Australia. Other countries like Canada, their process requires for you to actually be there to start the qualifying exams. But for Australia, you can actually prep for it and sit for it before you arrive. Now, in terms of the kaps exam itself, is a closed book exam. The use of reference is not permitted, so you cannot use reference materials. It's got paper 1 and paper 2. It's 100 questions for each paper, and they'll give you about 2 hours. It's a timed exam, and it's delivered through Pearson. You need to get 50% in all sections. I think that's very important with the kaps. Just a little bit about the kaps syllabus. For the interest of time, I might not be able to go into that deeply, but you've got your pharmaceutical chemistry, you've got your pharmacology and physiology, and I'm sure just looking at this, it's kind of a lot. So that's where having the right resources, having the right support, having people to guide you, people who have gone through it, it's quite important. So you don't waste time studying things that are not important. But again, this is what it covers, paper 1. And then for paper 2, you've got your physical pharmacy, you've got your pharmaceutics, microbiology, extemporaneous preparation, calculation, dose determination, drug information, drug interaction. It's quite a lot for the paper 2 also. But again, like I said, it's not a difficult exam, and I would not discourage you if you want to come through the Australian pathway of becoming a pharmacist through kaps. Don't be discouraged. It's something you can do. You just need to have good guidance support, and that should be fine. And in a few months, you can actually prepare for this. Okay, so let's talk about after you've passed the kaps. So again, like I said, you do the skill assessment. As soon as you do the eligibility check, you see if you are successful, you sit for the kaps exam, and after that, you get your skill assessment outcome. Now, your skill assessment outcome is valid for 3 years. What that means is after 3 years, if you haven't used that assessment outcome, you might need to go back to Australian Pharmacy Council. And usually it's on a case-by-case basis. They might have to reassess you. Now, what do you do with your skill assessment? There are 2 things you could do with it. For those who are trying to apply for visa, this is very important for those who are offshore. You would need your skill assessment to apply for Home Affairs for whatever visa you're trying to apply on, because the skill assessment, that is the one document that is used to show that whatever pharmacy degree you have overseas, is recognized here in Australia, and that you've sat the Australian kaps exams and you have passed it. Now, the other thing you would need the skill assessment form for, you would also use that when you're applying for your provisional registration with APRA. Let's talk a little bit more after you've passed your kaps. Now, I know for most people, you hear about kaps a lot because that is the first step. Now, the thing is, after you've passed kaps, you're still not an Australian pharmacist. For you to become a fully registered pharmacist in Australia, you have to complete your internship.